This is a plain CT scan brain of a 53 years old male patient. The patient presented with severe headache and left hemiplegia. CT scan was done previously somewhere else which was labeled as intracerebral hemorrhages involving supramiddle parts of right frontal lobe and the adjacent parietal lobe. Now these are hyperdense areas which are involving supramiddle part of the frontal lobe and adjacent right parietal lobe. Subrectant hemorrhages are also present. These are the linear irregular areas of increased attenuation. Similar hyperdense areas are also present along the fox cerebri. Mild surrounding edema and mass effect is present. Now this was labeled as the intracerebral hemorrhages. Now we have to very carefully see and examine and then comment upon the final diagnosis because the management it differs. Now please observe these hyperdense superficial cerebral veins along the outer surfaces of upper parts of both the parietal lobes. Similarly, upper part of the superior sagittal sinus is also hyperdense. Please see this hyperdense. This is also suggestive of being thrombosed. This is the coronal scan. Please observe subrecurrent hemorrhages, venous infarct with intracerebral hemorrhages, hyperdense superficial cerebral veins along the upper parts of both parietal lobes, and hyperdense superior sagittal sinus suggestive of it being thrombosed. Now I will show you his CT venogram. This is the CT arteriogram, which is essentially normal. Now I will show you his CT venogram. Please see this filling defect here. I will show you the coronal scan as well in the superior sagittal sinus. It is severely thrombosed. This is the coronal CT venogram. Please see severely thrombosed superior sagittal sinus. Only its centro-inferior and postero-inferior parts are patent. This is the superior sagittal sinus. Its posterior-inferior part is patent, although small thrombi are also present inside it. This is sagittal scan. Please see severely thrombosed most of the superior sagittal sinus. Its antero-inferior part is patent. Its postero-inferior part is also patent, but still it contains small thrombi inside it. The rest of the dural venous sinuses are patent. This is 3D reconstruction of the CT angiogram, because basically the patient was sent to us for the CT angiogram to see any aneurysm of anterior cerebral artery and its branches, to exclude the intracerebral hemorrhages. So one has to be very careful in interpreting the intracerebral hemorrhages, and please always look for the hyperdense superficial cerebral veins suggestive of these being thrombosed or hyperdense dural venous sinuses, because the management differs.